The annual World Health Summit, in partnership with the World Health Organization, is billed as the world's foremost strategic forum on global health, a gathering that will seek solutions towards sustainable health systems in the context of building back better.
Of course, one of the critical issues is that things like routine immunization have been dramatically affected by the pandemic. We've seen a drop in 2020, very severe drop in the middle of the year. Then at the end of the year, around 4% globally. Last year, around 1%, so getting better. But we have to restore that immunization so we don't end up with future outbreaks. And we've seen outbreaks of other diseases like polio get worse. And so the challenge is to both build back better, but also to be prepared for the inevitability of more outbreaks. We're entering the era of many outbreaks. The estimate is 2% year increase in the possibility of a COVID-like pandemic because of climate change, increases in population, et cetera. And so we need resilient health systems for the world to be able to deal with them.
He pointed to local leadership as absolutely critical in ensuring that resilient health systems leave no one behind.
The answer is countries can step up. The question that I think every country will have to ask is, do they now need to build systems for all ages? And I think that's an important question because traditionally in developing countries, we focus more on maternal and child health, not necessarily on care of the elderly or of people with other chronic diseases. And yet we found in this particular epidemic or pandemic that they were the most vulnerable, and people stretched to reach them, but we don't have routine systems to reach them. And that is going to be the question of whether we're going to build those or not.
While developing core competencies in the health manufacturing sector will be an important peg moving forward.
Unfortunately, it is often said, let's build a new system outside, let's build a new institution. That's not what we need. One of the things we learned is that in an emergency like COVID, what we're going to see is vaccine nationalism, and we're going to see export bans. And that's why it's important to also make sure that there's distributed manufacturing of vaccines. And that's one of the priorities right now, because Africa, of course, right now only produces 0.1% of the world's vaccines. We need to change that.
With work underway from South Africa to Senegal to Rwanda to establish regional hubs in an effort to bring vaccine and therapeutic manufacturing to a continent left largely dependent on imported immunizations during the COVID-19 pandemic.
But what is a sustainable business model? Why is that important? It'd be very easy to put up some plants and produce, say, COVID vaccines, but we don't know what the long-term tail of COVID is going to be. We're going to need routine vaccines, how often, how many, and yet you need to have a facility that's there over the long term that can be called back into service if there's a new epidemic. So to do that, what we want to do is get those companies to produce routine vaccines. So in the peacetime, if we want to call it that, they're producing vaccines that help save lives, that people want, that will have a revenue source that will keep them functioning, and then when there is another pandemic, they can pivot to producing those products.
The World Health Summit providing a space for the politics of public health to intersect with science and innovation for a world in desperate need of sustainable and resilient healthcare systems capable of withstanding the next disaster. Sherwin, Bryce-Pease, SABC News, New York.